500 tests were positive. PNG's Prime Minister says up to 1 in 3 people there could be infected with COVID-19. Tracy Yuen is a health advisor at ChildFund Australia, an independent organisation devoted to reducing poverty for children. She says we should be cautious reading those results.
Clearly those cases are really concerning, but we do need to take into account that the overall testing rates in the country are still very low compared to the population. And because tests are in limited supply, the requirements for being tested are quite high. So we are seeing those people most likely to have COVID being tested, and this in turn gives a very high positive rate. So it's really difficult to make a direct assessment based on those figures alone. However, what we do know is that in this current surge, there are many more people who are symptomatic coming forward from the public for testing, around 70 to 90%. And there are fears that COVID will become very widespread, especially when you consider in Port Moresby there's often water shortages, overcrowded living conditions, and many people are not practicing prevention measures. So we just don't know the real rates around the country because the testing is so low, but it is clear that the outbreak is spreading rapidly right now, and PNG will need extra support to deal with this crisis.
Last week, of course, the government was appealing for further help from Australia and right across the region, in fact. Do you think they are getting the support that they need right now?
Well, I feel like the Australian government is definitely acting. They've committed the $300 million towards the COVID response package to the Pacific, including PNG. They've committed to supporting procurement of vaccines for our neighbours. But what we need to do is make sure that this investment of funding and resources is going in strategically and at these high impact points. Right now, with the current surge in cases, we are at a critical for COVID control in Papua New Guinea, and it really is a key time to be meeting that surge in cases with a surge in investment with vaccines and with the additional support.
And what would that additional support look like? The health system in Papua New Guinea is precarious, to say the least. Do they even need medics to go in there?
PNG is a very difficult situation because the health system was already so stretched even prior to the pandemic. We were regularly seeing shortages in drugs, in hospital beds, in staffing and human resources. So add into that mix having COVID, all the additional needs for that, they're really running bare thin. So any kind of support in terms of human resources, vaccine supplies, funding, coordination support, the technical expertise that Australia has and has demonstrated in their amazing control of the pandemic in Australia, PNG would really benefit from any of that kind of support.
How, in terms of vaccine supplies, how critical is it that PNG gets access to a substantial vaccination program to try and mitigate the spread?
It's really critical. Again, with this current surge in cases, it is that critical junction where they need to act and act quickly before all of the other services and systems collapse under the weight of what's happening with COVID. What we know is the immediate plan for vaccination at the moment only involves what PNG has under the COVAX facility, which is in the initial instalment is 3% of the population, and that's focused on essential workers like health staff and border workers. But as you said, that's only due to start arriving in April. And in addition to that, after that, there's the rollout and all of the complications with that. And there aren't any solid plans or deals in place for securing more vaccine stocks after that. So yeah, we need to be getting vaccines into PNG as a priority as soon as possible.
Well, we've seen different variants from Brazil, South Africa, the UK. When it spreads like this in an uncontrolled way, does it create conditions for further mutation?
It is definitely a risk. And one of the additional challenges to that is when you have a lot of spread and a lot of cases happening, but you're not sequencing to find out what the variants are. So as I mentioned earlier, in this current surge, we're seeing a lot of people with symptoms coming forward for testing. In the past, there was a higher rate of asymptomatic cases being found. So, you know, what's happening under that, we don't know. There's no systems in place in PNG to kind of do that kind of surveillance. And that it's a worry anywhere in the world where you've got spread, but you're not actually doing the proper surveillance to see what's changing in the virus as that's happening.
Well, you do a lot of work with the most vulnerable communities in Papua New Guinea and across the Pacific. How concerned are you about those who don't have the resources there to support themselves?
This is the biggest concern. Beyond the health impacts of COVID, there's definitely the economic impacts for the broader community. PNG is one of those places where people earn money one day, they spend it the same day for their families' dinners. So if the country was to go into lockdown, a large portion of the community is not going to have the resources to keep going. You know, we're worried about kids being out of school. We're worried about the ongoing impacts for children's vaccinations and diversion of resources from essential health services to mothers and children. And it's just impacting so many aspects that it is a real concern for us.
Well, Australia is working to establish a travel bubble with Singapore that could be operational in July. The deal could also see the island nation being used as a quarantine hub